You may use that with the
And good afternoon and welcome to Straight Talk. This is your Drive to Five show. Catherine Tyson, your host. Thank you so much for joining me this afternoon. It is Medical Mondays, and of course, you know, on Medical Mondays, we are joined by the Health City folks that come all the way from the East and Canada Bay. They're within our reach. So thank you so much, Health City, for sponsoring Medical Mondays for us. And of course, today, as no different than any other Monday, we will be talking about some type of awareness. Today it happens to be lung cancer awareness, which is observed in the month of November. So thank you all once again. Hope you've had a good weekend. It's Monday morning. It is a dreary Monday morning. It's
evening.
Monday evening. Thank you. Here's afternoon put Ben on. Ben needs to keep me straight. Ben, you can hear just out of bed.
It sounds that way. I'm sure everybody would love to be that with this
Trust
weather.
me, I'm looking outside. Outside, it feels like it's morning. You're right. It has been a crazy day. It has been so dreary. So yeah, it is definitely an afternoon. And thank you all so much for joining me. I did want to just say quickly some words of inspiration. So every blessing that occurs in your life is not always meant to be shared on global platforms. I saw that and I thought that was so interesting. Saying some folk can't hold water, you're bursting at the seams to tell anyone who will listen about blessings. Remember this: not everyone is rooting for you to win. Not everyone needs to know your wins. You need to know your wins and thank God for your wins and continue to be blessed in silence. And I just love that because I think a lot of times we want to share our good news, and sometimes people are not necessarily happy for us, and it kind of thwarts the progress sometimes. So that's my word for this afternoon. So you just heard the voice of Ben Mead, who's a new voice in the studio with me. Are you a new addition to Health City, or are you
Yes, fairly new addition. Yes,
yeah,
happy to be on board.
okay, well, good to see you. I know you obviously from the media too, so it's good that you're here. You are the marketing and communications manager
That's right.
and responsible for coordinating the marketing and communications related activities with services offered at Health City. So welcome, 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 and thank you for joining us this afternoon.
Thanks for having us,
Minister Fair.
Catherine. As usual, it's a pleasure to be here. It's been a while since I've been in Star,
Yeah,
but glad to be back.
yeah, absolutely. We're glad to have you. For sure. Now, we also have Dr. Archita, who's been with us before as well. No stranger to the Star Studio. She is a consultant pulmonologist at Health City. And we work also with critical care, sleep medicine, and we've been associated with this field for well over 15 years and heads the infection control department at Health City. Yes? Okay, good. So now that our introductions have been done, good afternoon and welcome, Dr. Archita, for joining us.
Good afternoon to you as well, Catherine. It's always a pleasure.
Yes,
Well, the
absolutely.
location is new, but I've come here before.
Right, right. Yeah, this is fairly new location. It feels old now, but it's yeah, it's different than around the corner, right? Well, you guys are here to talk about lung cancer awareness this afternoon. So Ben, you want to kind of start us out and just introduce the topic really?
Certainly, as you mentioned, November, in the month of November, Lung Cancer Awareness Month is observed. That's one of the cancers that all of us would have heard about as children growing up. It's one of the more prevalent cancers that we hear about. And what we are doing for the month of November, we're asking people to scan earlier and breathe easier. That's because we're offering a targeted lung health check program. And this is what we're doing to raise awareness about the importance of early screening for lung cancer. We're going to be doing this throughout the month, as we know that early detection is very critical in treatment of lung cancer, as Dr. Archita will explain. So we sat down and figured what could we do? And one of the things we looked at is a low dose CT scan of the lungs,
Okay.
followed up with a consult where you review your information with Dr. Archita. And we're offering that at $50 CI. And you're not mishearing me if you heard 50.
Right.
And I'll tell you the importance of that. We sat in a meeting and we said, this is not about how much we could bring in. This is making it affordable, getting the people who we need as a community to preserve their lives. if you're a smoker, and we have certain parameters that you should get checked out because statistics show that if undetected, there's a stark difference between detecting lung cancer very early on and treating it and leaving it for say 5 years. Your chances of survival fall drastically. So I just wanted to put that on the table. So that's what we're doing. So for 50 CI dollars, you can get the low dose CT scan of the lungs, and Dr. Archita might be able to explain more about why we do low dose CT. And it's a CT scan, which anybody who's done a CT scan knows those could be quite pricey.
Right.
So you get that, and Dr. Archita, a leader in her field, is able to then give you a consult at the end. I'll let you know, yes, you can breathe easier. And that's what we want. We're not hoping to catch anybody cancer. We have some people who are at high risk for this, and we'd like to give them an opportunity to get eliminated, breathe easier, knowing that you don't have any cancer, or if there's any detection of it, we have people like Dr. Archita here who can take the greatest care.
All right. Okay. So Dr. Archita, so talk to us a little bit about this test that you'll be doing and this consult
That's
that you.
So to begin with, I think when it's our goal that November is marked worldwide as a lung cancer awareness month. And the reason why we need to even talk about lung cancer is for people to know that lung cancer is one of the biggest killer among cancers of mankind. So it's the commonest cancer to occur in men as of now, and in women the third commonest. And it's among the top leaders, among cancers which cause cancer death. So it's the largest cause of cancer death among men, and the second largest cause of cancer death in women.
Okay.
So it's not something that we should take lightly.
Okay.
We know that lung cancers have very typical and very recognizable risk factors, unlike certain other types of cancers where we may or may not be able to determine risk all the time. But we know that cigarette smoking is a strong risk factor for development of lung cancer, including other environmental exposures to certain chemicals.
Okay.
Cigarette smoking by far is one of the top most leading causes of developing lung cancer. So there have been multiple studies, not from now, from the 70s perhaps, where there been thoughts about incorporating a test which would truly be able to identify lung cancer early. The earlier the cancer is diagnosed, the lower the stage of the cancer. If it's more advanced, we already know the cancers are stage 1, 2, 3, and 4.
Right.
And they are more in severity and spread the more the stage is advanced, right?
Right.
So diagnosing lung cancer early and treating it when it's a stage 1 or a stage 2 for that matter has far better results in terms of survival and what we know is in terms of cancer progression-free survival that we can achieve. And so the early diagnosis is the key. So there were many tests, many modalities which were put forward. As you may know, for certain cancers, we have blood markers you can do. For prostate, you can do a blood test, which tells us, okay, the level is very high. There's nothing such for lung cancer. Okay. So there were multiple other modalities which were put forth saying, okay, can we test somebody's food to see if they have cancer cells in it? Some people talked about doing X-rays. But with many years of scientific research, it has been concluded that probably the best and most a test, most reasonable test to do, which would give us better yield compared to the risks that it poses, would be a low-dose CT scan. Okay. Now, a CT scan is, as we all know, or what we previously called CAT scan. It's a computerized assisted tomography, where an individual is exposed to multiple X-rays and multiple slices of the lung or scan to look for nodules or abnormal findings, which would then help pick up a cancer-looking lesion quicker, right? Now, why the term low dose is to reduce the amount of radiation that is given, because remember, this is a screening tool. And we all know that, yes, repeated exposure to radiation in itself is a risk for cancer. Okay. So when we do a dose reduction protocol, we're giving a minimum amount of radiation to get good results using, technology to our advantage, and are able to pick up small lesions faster, so that then they can be further assessed. If this is suspicious of cancer, these lesions can be further assessed with a biopsy or a closer follow-up, risk reduction in terms of guiding individuals to quit smoking, So this is something that can truly help reduce a relative risk reduction of about 20% from cancer death or lung cancer death in individuals who undergo lung cancer screening.
Okay.
So I think it's an important modality if we can do that.
Right.
Now, people may argue that the absolute risk reduction may not be that high, but it's still worth doing in this category of high risk individuals.
Right. So now I have a question. You said that it's the leading cause of death in men. I mean, it's the leading cancer in men.
Yes,
Okay.
leading cause of cancer
The leading cause of cancer.
and in
Okay.
women for that matter.
Okay.
Yeah.
My father had lung cancer as well, 5 years ago. And well, he passed away 5 years ago actually. And he had been at the time that he was diagnosed. He had been given like a year to live, but he actually lived almost 2 years beyond that, which was good. But yeah, I'm just listening now, just thinking, yeah, just early detection, obviously, and that's one of the things I think about any cancer, right?
That is true.
Yeah.
Any cancer.
Okay. So what are some of the things that you think that people can kind of look out for too? I mean, this is just something to just get checked, right? Period. This is what we're talking about today. But are there some things that they could look out for as well that they might, that might be indicators that, you definitely need to come in and get this test anyway?
That's right. So usual symptoms, unlike other cancers which may start showing up, relatively early in terms of symptoms, in women, breast cancer is one of the leading causes of cancer again, or one leading types of cancer. There will be some kind of a palpable one, or you can do an annual mammogram, for example. The analogy is the same, early detection, right?
Right, right.
Uh, in some types of skin cancers, you would start seeing an abnormal area on your skin, which is
Right.
again another type of common cancer.
Right.
In colonic cancers, people say, okay, if you have diarrhea, bloody stool, or abdominal pain, you do this. But lung cancers usually take a long time to manifest.
Oh, okay.
And
Okay.
usually by the time they manifest, you would have a significant amount of disease.
Okay.
And hence the role for screening. However, some of the symptoms to look out for is if you've been a smoker and have been smoking for a reasonable period of time, usually our benchmark for screening is 25 years. So if you've been smoking a pack a day for about 20 years, or more for a lesser duration, which amounts to about the same, you're at a higher risk. If you're an individual who's between 50 and 80 or more than 50 years of age, you're at a higher risk. Because you've had enough time to smoke and to develop cancer.
Right.
If there is somebody who has a chronic cough, who's a smoker and has a chronic cough, or has been coughing up blood, or has been losing weight, losing appetite, feels increasingly short of breath. Of course, these could be symptoms of other problems as well, but this would be something alarming. And these individuals should seek medical help.
Okay. And so, in terms of this test, would this be something that you would suggest that they get more than once, like a regular thing? Like, is this like a regular screening they should do yearly or something?
Yes. So this is like I gave you the analogy for women being screened for lung cancer, for breast cancer, sorry. They undergo an annual mammogram. Similarly, for high-risk individuals, and I will at this point in time want to touch upon the criteria because we've already mentioned and hinted at it. So individuals who are between 50 years of age and less than 80 years of age are to be included in this pilot screening thing.
Okay.
And these individuals, and they should have been a smoker in the last 15 years, or continue to smoke at this time, or have quit smoking no longer than 15 years ago, and have a history of at least smoking 20 pack years, as I just mentioned, which would amount to a pack a day for 20 years. Could be more years and less number, but if it comes to the same amount, it's considered the pack year history of smoking.
Okay.
So these are individuals who are usually included in the lung cancer screening. It's not for everybody. Just because I smoked for 10 years and I've quit 30 years ago, maybe you're not a candidate. But if you're between 50 and 80 years of age, if you've smoked about 25 years, if you are a current smoker or have quit smoking in less than 15 years, within the last 15 years, then you're a candidate for this lung cancer screening.
Would this be marijuana use as well?
Usually this is for tobacco smoke.
Okay. Okay.
So if you're rolling tobacco along with the marijuana, well, it would amount to about the same amount, right?
Okay.
So, but usually this is typically for cigarette smoking, the amount of pack years that we're calculating.
Okay.
But any chronic smoker who's been a smoker for a long enough time, particularly using tobacco or tobacco-related products, is a candidate for lung cancer screening if they meet this criteria.
Okay.
Right? It's not for anybody and everybody who's ever smoked in their life, if they fit into this criteria.
Yeah.
And it is something that you do annually. So if you have a positive screen, if you find a nodule in your lung or some abnormal finding, then of course it warrants intervention. Sometimes it may be too small to warrant intervention, and we may advise more close follow-up, maybe 3 months or 6 months, depending on the size or the risk factors.
Right.
Sometimes it may only warrant if the screen is negative, then it warrants a screen annually. And the amount of radiation that you get is really not much. So a low dose CT is safe to do, even if it is done annually.
Okay.
If somebody is having a repeatedly negative screen, well, we may think of getting them off the program and doing it less frequently. But
Okay.
that's a case-to-case decision making that we
Okay.
have to do.
Okay. And my father wasn't a smoker either, but he was on the ships like when he was younger, and so those are
Asbestos exposure.
yeah. So those are some things I think that if our gentlemen have a history of that as well, going out to sea and stuff, just get checked out with these
But Catherine, you're speaking about pretty much every Caymanian family will
Right.
have somebody
A
who at
seafaring.
some point in time was a seafarer
Yeah.
and were exposed to those conditions. And
Absolutely.
as we know, on the ship sometimes, that's how the pastime. You
Right.
smoke a pack, or you roll a cigarette and you smoke it.
Right.
And you're seeing for many years and you're doing that.
Yeah.
Think of
Or exposed to the machinery because that was
exposed
his
to the
case.
machinery. That's what
Yeah.
I'm saying. So exposed to the machinery or they're smoking.
Right.
Think of how many friends, cousins of yours, and you go through who have somebody else, and it's unfortunate that the situation with your dad, but think about how many lives could be saved if
Right.
we identify it uh, early enough. And I hate to be the boogeyman, but there was a 2018 U.S. National Database Statistics report that said there's an 18% 5-year survival rate for lung cancer.
Okay.
That doesn't sound that daunting. Let's flip it the other way. That means there's an 82% chance that you won't make it if you
It,
have lung cancer for
it,
that long.
it sounded daunting anyway to begin with, so for sure.
Yeah, so
Because 5 years is not a long time,
it's not a long time.
you know, for
And,
sure.
and people driving home right now and thinking, oh, Uncle so and so,
Right.
or my dad, and you're hearing about these people.
Right.
These are the people we're speaking about, people living here on the island who might be at risk for lung
Right.
cancer.
Well,
And
that,
we meet the
yeah.
criteria.
Yeah, to go get this checked out.
Yeah.
Yeah, for sure. And then also with the check, they're able to speak with Dr. Achita.
That is true. And again, because we were talking about asbestos, I just want to mention here that concomitant exposure to asbestos and to smoking is a higher risk factor for lung cancer,
Right.
for sure.
Okay.
However, for the purpose of the screening, the history of smoking is essential. So
Right.
if there's a history of asbestos exposure too, these individuals are candidates for lung cancer screening. And for mesothelioma screening, as we know, it's the more common form of cancer to happen with asbestos exposure.
Right.
But as part of this particular program, it's more the smoking and asbestos or the smoking exposure that we're talking about to meet the criteria to be able to, but all the same, if there is any element of doubt, there's no harm in consulting or calling and, getting the scan, and we can then reassess the situation.
Yeah, and
Right.
that's why we ensure we've made it so affordable because there may be people who have a question mark, a small question mark above the head, somebody with a larger one. We don't want you to think, okay, I'm going to have to dig deeply into my pocket to get this done. It's like, no, you have these concerns. For
Right.
$50, you can get all of this diagnosis done, the low dose CT scan, and a consult with Dr. Ajita.
Yeah. All right. For a very, very low, I mean, that's not even sometimes just the price to see a doctor, like, period. So this is really an opportunity for people to come out. So how can they, get in contact with you?
Okay, well, it's very simple. You can call our regular number, 640 4040. So I'll repeat that, 640 4040. Or you can simply email info@healthcity.ky.
All right. So it's lung cancer awareness. It's observed this month, and Health City is offering a targeted lung health check program, and that's for this month, the entire month of November. The aim to raise awareness on the importance of early lung cancer screening. It's a leading cause, as you heard Dr. Chuda say, of cancer-related deaths in men and women worldwide. The first one in men and the third in women, you
But
said?
then it's the second
The second, okay.
cancer related.
And so the screening would be a low dose CT scan, and that you're able to get that kind of targeted lung health check for $50 per patient, and then an opportunity to speak with Dr. Archita about this. So yeah, so basically, if you are having any thoughts or whatever about your lung health at this point, I think we all need to be thinking about that because we're all using them, aren't we?
We need our lungs.
Well, I tell you, sometimes, especially these days, with wearing the mask and stuff like that, I think you're more aware of your lungs more than ever. Do you
Mhm.
think? Yeah.
Absolutely.
Right.
And it's a time where we're all focused a bit more on health, right?
Right.
And everybody's thinking, okay, I have to mask up, protect myself from COVID. Yep, that's a real life situation now.
Right.
The same way, if you were at risk for lung cancer because you exposed yourself to lots of cigarette smoke, you were around all of these machines, think about it.
Right.
You should have yourself assessed. Uh,
Definitely.
and put, if anything, if it's the best thing that comes out of it, that you put your mind at ease,
Right.
that is one thing.
Right. Of course. So yeah, people who have a history of smoking, 50 years and older, are current smokers or have quit in the last 15 years to scan earlier and breathe easier to detect lung cancer at an early stage, allowing them to get the treatment they need. The special promotion for this month is $50 per patient, and qualifying patients will receive a low dose CT scan. I want you to explain a low dose CT scan as well a little bit more, and a follow up consult at our Canada Bay Clinic with Dr. Archita, who's a consultant in pulmonology at Health City. So, yeah, the low dose you mentioned. Now, what is the difference between a low dose and just a regular CT then?
It's simply the number of X-ray exposures. A CT scan is multiple X-ray exposures
Okay.
of an X-ray. It's simply by using a faster machine and using certain protocols that a radiologist is able to do to reduce the amount of X-ray radiation that is being given during the scan. Yes,
Okay.
the precision of the scan need not necessarily be low, and usually for most scans we do a dose reduction protocol, as we call it, just in general.
Right.
But for this particular scan, it's done as a quick non-contrast scan where an individual is in the machine. It's a 128 slides machine where a quick scan can be done within a few seconds. And the amount of exposure, the number of X-ray beams that you need to pass is reduced significantly.
Okay.
So instead of getting into the multiple technological aspects that which a radiologist would be able to explain better to you, in short, the amount of X-ray radiation being given is significantly less.
Okay.
Right.
All right.
So it's just by setting the settings on the CT scanner to reduce the amount of X-ray exposure that is being given.
Now, do you
Sure.
find that here in Cayman that we have a lot of incidents of lung cancer more?
It is surprising.
Yes.
Surprisingly, for such a
Okay.
small population,
Right.
surprisingly more. And both in smokers and non-smokers, it's not like non-smokers cannot have lung cancer, as you mentioned, unfortunately, in the case of your father.
Right.
But of course, he had some other environmental exposure. However, people without history of smoking can also have lung cancer.
Okay.
However, this is not a population that we can screen. These are individuals who should preferably report their symptoms the moment they get it, not neglect it. So
Okay.
the symptoms we talked about, a chronic cough, coughing up blood, losing weight, losing appetite, having unexplained shortness of breath or chest pains that are unexplained. These are individuals who can, but that's the less common subset. The commoner subset is individuals who have a history of smoking, and
Right.
these are individuals who can be targeted for screening.
Right.
Right? So just to make you understand a little bit better, and it's always better to do a targeted screening rather than randomly screen everybody on island,
Right.
because that would only mean doing unnecessary tests.
Right.
The results have been better, the outcomes and relative risk reduction from lung cancer death are significantly better in people who are heavy smokers or
Right.
have been heavy smokers within the last 15 years.
Right. Now, the thing is, a lot of people are afraid, right? They're
Mhm.
afraid to get tested because they don't want to find out. But that's actually the opposite of what they should be thinking, right?
Very true.
Yeah.
Very
So
true.
because
Closing your eye when a car is about to crash it doesn't prevent you from dying from the
Right.
crash.
Right. Right.
Opening your eyes and trying to run for your life will.
Right.
Correct.
Exactly.
I love that analogy.
Great
Think about
analogy.
it. It's
That's a good
better to
one.
know than not to know, especially when you can take measures to
That's right.
prevent the worst case scenario.
Right. Right.
And even if a low dose CT scan does give you a negative result, it's a very big reassurance. So, in continuation to, I think what Ben has been saying previous years, in continuation to this year's concept of the healthcare conference that we had, and
Right.
of which we were a part of, myself being a part of the conference, breathing easier, being more comforted, or
Right.
having an incentive if you're a current smoker or have been a chronic smoker and are continuing to smoke, to give up and say, this is an eye opener, right now my screen is negative, doesn't mean it will be so next year.
Right.
So I should give up. Why should I continue to,
Right.
increase the risk of, cumulative risk of developing cancer by exposing myself to cigarette smoke? So these are all beneficial outcomes of undergoing a thoughtful process or a screening process when you have a risk factor.
Right.
Because it also encourages individuals to then modify the risk factors or to, make behavioral changes to modify those risk factors.
All right. So I have two questions. So one is, if someone has been a chronic smoker, they've smoked for 13 years, is it? I mean, for them to decide I'm not going to smoke anymore, and like you just said, right,
Mhm.
to I guess decrease their risk of lung cancer. Would those 15 years have already done that damage, or stopping now would be a good thing for them?
Stopping at any time, even after the diagnosis of lung cancer,
Okay.
helps in the outcomes,
Okay.
for sure, right?
Okay.
So it's never too late to stop smoking, is what I tell people,
Right.
right? The idea is, yes, the damage would have been done to some extent, but at least the ongoing damage will be prevented.
Right.
And as we said, we've used this, why most studies have incorporated this 15-year mark is because there has been relative reduction in the risks when somebody has already quit for more than 15 years.
Right.
Their chances of now developing a new lung cancer are far less, right?
Yeah.
So hence this inclusion criteria. So not that it will completely eliminate the risk of developing a cancer, but
Right.
the risk comes down if you quit for more than 15 years and you've not so far been detected to have one, right? So
Right.
it's less likely that you'll develop one now.
Yeah. Oh,
Not impossible,
right.
less likely.
Right. Okay. And the cases where someone has smoked for 20, 30 years and never developed lung cancer is one of those things that is not really
It
kind
doesn't
of.
necessarily happen to all smokers,
Yes.
otherwise the incidence in the population would be much, much higher.
Right.
But it does happen to individuals who are genetically predisposed, and sometimes it's an individual. They develop a mutation, they have a selection of that mutation, they develop cells they start propagating, and they end up developing the cancer. So it's
Yeah.
unpredictable.
Yeah.
And like I said, the symptoms when they do start coming on, especially with lung cancers, it's usually that the cancer is too big and it's causing compression on something, or it's large enough to have causing bleeding in the airway, or it's large enough to have caused fluid outside of the lung, which starts giving them pain or shortness of breath.
Right.
A lot of times, smaller tumors go unnoticed, and
Yeah.
usually when they're small is when they're most treatable.
Yeah. And in my father's case too, it metastasized. So it's metastasized. So it moved like it was
That's
just
right.
yeah.
So that's very notorious. Lung cancers, or like any other cancer, can be very notorious for metastasis. They
Right.
spread to other parts of the body.
Okay. Yeah. So that's why it's.
That's why the early detection. So if it's detected when the tumor is small, when it's resectable, when you remove it, and a surgery can even be curative, depending again on the stage. So
Right.
if it's picked up early, and you get rid of that area of the lung or the lobe of the lung, in which the cancer is located, and there's no other spread to the regional lymph nodes or elsewhere in the body, the nature of the surgery can in fact be curative for cancer. And all these individuals will require then would be follow-ups
Right.
and quitting to smoke. They may not even require systemic therapy like chemotherapy or radiation. But unfortunately, very few people are picked up at that stage.
Okay.
That is the unfortunate part.
We're going to take a quick break, but we'll be back up with more. We're speaking with Dr. Archita from Health City. This is Medical Monday, as well as Ben Mead, who's a marketing and communications manager. And this is Straight Talk Drive at 5. We're talking about the lung cancer awareness, which is observed in November, and Health City offering a targeted lung health check program for $50. It's a health check screening. We'll be back with more. Stay tuned.
Are now open. 943-3700.
Breathe Easier. That's the name of the campaign where we are focusing on the health of your
What
lungs.
was it again?
Scan earlier, breathe
Okay,
easier,
good stuff. All right.
right? And it's multiple ways. You breathe easier having a scan, knowing that your lungs look okay, or you can breathe easier knowing that if, in the unfortunate event that we find an adverse finding, we have the care, the specialist who can take care of you.
Right.
So for the month of November, as we've now started the month, we're kicking off the month, Lung Cancer Awareness Day month around the world. And we are going to say if you book an appointment and have your appointment between now and at the end of the month, so you have the entire month, it's available. You get a low dose CT scan of the lungs, uh, and that scan would be scanning for any abnormalities,
Right.
and that's followed up with an appointment with Dr. Archita in her office. And we know a lot of people have enjoy the drive to East End, but sometimes can't quite make it back there for a second time. So the consult, we offer that at our Commander Bay Clinic. So we have Dr. Archita right there. So you're getting the quality of service that you need and the compassion that Dr. Archita has for all of her patients. You get that. And we offer that at $50, Cayman dollars, 50. You heard me correct. The radio didn't glitch, and
Right.
you're wondering if there was something before
Right.
the 50. It's $50 because we want to make this affordable. So everybody, there's no hindrance for you to get scanned. And we're looking at people who have a history of smoking and are a bit uh, up in age, 50 years and older, uh, who have exposed themselves uh, to possibly having lung cancer. So we want to help you out here, address this. And I'll repeat the stat that I mentioned earlier in case somebody missed it. So there's a study in 2018 that said there is an 18.18 uh, 5-year survival rate for lung cancer. I'll flip it and tell you 82% chance of mortality means these are things that you want to have addressed. You want to identify it. It's no point sitting at home saying, I don't want to know.
Right.
And then you feel sick, and then you're at the point where care can only go so far. I want you to be brave. Come on in. It's non invasive, it's very relaxing. The team is very professional. They'll take care of you. And you have that follow up with Dr. Archita to make sure your lungs are in check. So think
Right.
about members of your family. If you're not a smoker, your dad, your uncle, your cousin, somebody who might have been out at sea as well, and they're known to have smoked for a long while and
Right.
heavily. These are the people we're looking to give them a chance to breathe easier.
Right. And so how long does it take, the whole exam?
So I'm just going to quickly touch upon this. So what needs to be done is the individuals who call in or contact the info line at Health City via email. They will be given an appointment for a scan. Usually this would be scheduled in an afternoon, and they will be told about which day and what time. Once they come in, they do a CT scan, which should not take more than a few minutes. So the scan involves, of course, changing into uh, out of your clothes into a gown, perhaps, because we don't need any metallic objects on them. So, no jewelry, no phones on them at that time, obviously, the pens in their pockets. So we usually ask them to change into a gown, if they could with their own clothes, but with having no metal on them. Uh, they lie down on a CT scan table. The scanner takes about a couple of minutes. So we do a screen or what we know as a scout flip, a quick in out. After that, a full scan, which is less than a few minutes to be honest, and they are done. The radiologist then looks at the scan and makes a report, right?
Right.
And in favor of time and to make it a little more efficient system, we are going to allow individuals to do the scan, say if they do it on a Wednesday or this week or a Thursday this week, they will have a consult the following week. So we have enough time to go through the scans, look at the images, and then talk to these individuals.
Okay.
and discuss their report and tell them, okay, this is what the scan shows. It's negative. That's great. If you have an ongoing history of smoking, we can talk about how to mitigate those risk factors, offer them smoking cessation advice or prescriptions if they so intend to, and give them a plan to follow up every year to do that, right?
Right.
If this is an individual who screens positive and there is something very suspicious, these individuals may go on to need a biopsy of that lesion and for the management with the oncology team or whichever way it may proceed, right?
Right.
If this individual has an intermediate lesion where we are not quite certain whether this is indeed a cancer or can be observed for some time, they will get a follow-up plan to follow up. So, every so often they'll be given a plan when their next follow-up should be,
Right.
and then we make a plan accordingly, right? So this is what an individual should expect. The scan would be, say, a week prior. The consultation will be in the following week, just to make things easier. Because as soon as you do a scan, it's not always possible to have an immediate report ready, right?
Okay. Okay.
So that would be the plan. Now there are certain criteria, although Ben has mentioned that it's fairly easy to do this, and anybody, again, mentioning the inclusion criteria, anybody who is a current or an ex-smoker within the last 15 years has smoked up to 20 packs a day, 20 pack years, or which amounts to about 1 pack a day for 20 years, or an equivalent, is between 50 and 80 years of age. And there's one more criteria, is able to consent to do the CT scan, obviously,
Okay.
right? So somebody who's mentally incapable of consenting or not, fit for the procedure may not be able to undergo, although there is nothing physical in the procedure that they don't
Okay.
have to consent.
Okay.
There are certain criteria which I would like individuals to be careful about that would not make them suitable for lung cancer screening. So if they already have a diagnosis of lung cancer and they're
Okay.
doing the scan just as a follow-up, this may not be the appropriate scan.
Okay.
Right? They may
All
need a
right.
more advanced scan or a contrast enhanced scan,
Right.
and they should consult their doctor. They may not be a good candidate if you're already diagnosed with lung cancer or are under follow-up for some other kind of cancer already, or are on treatment for another kind of cancer.
So this is not like a second opinion type of thing, is what
No,
you're saying.
it's a
Okay.
lung cancer screening program. We are
Right.
trying to diagnose individuals who are at risk and diagnose them early and help them,
Right.
not as a follow-up, because this may not be the appropriate scan. So if you already have a diagnosis of lung cancer and undergoing treatment, you probably don't need a lower scan. You probably
Right.
need a contrast enhanced scan, or you need another type of scan called a PET scan. So
Right.
let your physician guide you in that regard. If you're already on treatment for another cancer other than a skin cancer or a non-melanoma skin cancer,
All right.
then again you may not be a candidate for, because as part of your regimen of treatment or follow-ups for your primary cancer, you would be advised cancer screening of your lungs, right?
Okay.
So it may not be appropriate to just do a lung cancer screening individually, because that means just one more scan that is being done on you, whereas you already have a plan of follow-up for your primary cancer, all right?
Right.
So these again individuals may not, these individuals may again not be good candidates for lung cancer screening.
Right.
If you're less than 50 years of age, right, there will be outliers, right? There will be individuals who are less than 50 years of age but who smoke for more than 25 years.
Right.
It's always a good idea to discuss with a physician before you opt for a lung cancer screen. So it's typically for these individuals who are in this age group,
Right.
based on data from multiple studies, that a lung cancer screening is offered, and usually not for younger individuals.
So you're kind of, this is just a question too. It's almost as if it doesn't kind of manifest itself until about 20 years, is what you're saying
What I'm
about
trying to
that.
tell you, yes. So the risk of cancer increases beyond a certain age
Right.
when you've been smoking for so much time,
Right.
right? So doing it, if you are a 30-year-old and who smoked for maybe 2 packs a day for 10 years,
Right.
which again makes you a 20-pack-year smoker, and you continue to smoke, you may still not be a candidate for this lung cancer
Right.
screening,
Right.
for this particular program. But if you still have 20-pack years,
Yeah.
but you don't fit the age criteria.
Right.
So just to make individuals understand, there is no harm in seeking attention or seeking help to quit smoking, or even sometimes for lung cancer screening. We have seen outliers in the younger age group and in the much older age group where people develop lung cancer. But you may not be a candidate for regular lung cancer screening or to enter this program. Consult with a physician. You can consult with your regular physician, or you can come and talk to me. And then, if you are an individual who does need a scan, it can be done, but not as part of a lung cancer screening program if you're not fitting into these criteria.
Okay.
Do you
So
understand what I'm saying?
yeah, I'm understanding. I want to ask though, just for clarification, if someone is 30
Mm-hmm.
and they they have smoked for 10 years. You know, some people
Mhm.
start smoking at
Oh, yes,
14,
of
right?
course. Yes, they would have had
And
more than 20, 35 years.
exactly. But what you're saying is they don't fall into that
The lung cancer
vulnerable,
screening protocol thing, this is an ongoing, usually an ongoing process. We put
right,
them into a lung cancer screen program. We
right,
screen them every year. Probably they're too young to undergo repeated screening.
okay,
The risk of developing a lung cancer at a younger age is less likely. They are a
okay,
better candidate to quit smoking
right,
and then do follow-ups. But
okay,
it's not that we do not do cancer screening in such individuals at all,
right,
but it's done on a case-to-case basis,
yeah,
maybe a one-off. So
yeah,
it is better to consult rather than try to enroll for a program
right,
and then feel, as though, oh, I'm not being taken in, but I have the history.
right,
So I want people to understand the logic behind it. There have been multiple studies. It's not a criteria that I have decided or Ben has decided, but
right,
these
right,
are
of course,
studies, large,
right.
nationwide studies, worldwide studies, which have told us.
Well, yeah,
Yeah,
it's almost like it doesn't kind of manifest itself until you get to a certain stage of your life. So the question, and you can correct me if I'm wrong, but the question then would be, if someone is 30 and they have this history, but they're not going to be tested now, whatever. They should not think that they should go when they get to be 50. You know what I mean? Like they should,
they
right.
should think.
I want, yeah.
And it's not
And
as
like you
though,
said, stop smoking if you can,
yes,
because
yes.
that's
That's
your
what I'm
opportunity
trying
now,
to tell.
right?
Yes. So what I'm trying to tell you is that it's not like younger individuals do not develop cancer. A
Right,
screening program
right,
is done in a high risk population.
right,
You do not do screening for everybody,
right,
right? So for them to be, to say that, oh, I'm not eligible. No, you may not be eligible for a screening program,
right,
but you still are eligible for medical help. And it's not like people who are younger cannot have lung cancer because
right,
they have the risk factors, but not everybody will have. So
right,
they're not in that high risk population group. So we don't do a screening in everybody.
right,
So it's not like younger ladies do not have breast cancer, but the screening is usually recommended after a certain age,
right,
right?
right.
Because they are at a higher risk at that time. So
Yes.
the logic, the medical and the scientific logic behind screening is to do it in a high risk vulnerable population,
Right,
not in everybody,
right,
because that takes away the purpose and the yield of that test.
right.
Yeah.
So you're a doctor, so obviously I want to ask you, if that means that we're basically, as we get older, because I'm kind of feeling, the knees don't feel the same, the hip doesn't feel, the back doesn't, everything is different.
You can mention that again.
Yeah, no, for sure, right? I
Oh,
mean,
yes.
if it's not one thing, it's another, right? But it's as you get older, so obviously that body is breaking down, and
Mhm.
it's being affected very different than when you were 25.
Let's not use breaking down because I feel like an
I don't
old
know
car. It's
what's
not
it
as
called.
robust as it once was.
But I didn't say it. I'm not saying breaking down as negative. I'm saying that
Yes.
we're getting ready to go
Mhm.
back.
Mhm.
That's kind of it's a whole part of the process. I'm completely celebrating the whole journey, right? You start, it ends, but that's kind of what I'm hearing is that you at this point, if you are 25, if you are 30, you need to start paying attention to yourself and
That's
taking
true.
care of yourself. And if you are at this age, 50 and above, start to
You
get
should start
screening.
screening. That's
Yeah,
correct.
so-
And if you're younger and you have symptoms, please do not shy away from seeking medical help.
Right,
There's nothing wrong in doing that.
Right,
And if you are an individual, for some reason you're genetically predisposed, or for whatever reason you may be that one-off person who does have a problem,
right,
but you're not the right candidate for a mass screening,
right,
but more for an individualized decision making whether you will benefit from a scan or not.
right,
Right?
right,
So do not take this as a deterrent to taking help or
right,
seeking help,
right,
but just to make you understand that you should not feel as though, oh, I called and I didn't get an appointment because they just told me I smoked for 20 years, I
Right.
smoked for 50 years, but I didn't get an appointment.
We can get an appointment with your doctor. Is
Yes,
what we're saying.
because
Yeah.
that's more appropriate
Right.
rather than subjecting everybody to a mass screening program.
Absolutely.
Right?
Yeah.
But I would say, on a whole, if you have questions for the specialists that we have at Health City, feel free to send us an email,
Right.
and we'll do our best to get a Dr. Achita or one of the others to help us
Right.
reply to your query. Just send us an email, info@healthcity.ky. We're here to help.
Right.
World-class healthcare within your reach, and it's more than just words. It is really that.
Yeah.
And I can speak as the baby with new eyes, right? I can see the fear
Right.
that is manifesting itself in the decisions being made.
Right.
When I sit in a room with the Dr. Architas and the Dr. Benoist and talk about this program, it's about getting help to those who need it
Right, right. No, within your reach,
within your
for
reach.
sure. It's just very interesting, just, and I want to repeat what we said earlier, which is if you're 30, if you're 25, 30, take care of yourself. Start, make some good decisions. But if you are 50, between 50 and less than 80,
Usually, yes.
between 50 and 80, to get yourself screened, to get yourself checked out so that you can be on top of whatever problem you may have. But if you are not 50, you can see a doctor. You can, you should be looking about your health, whatever age you are.
Very true.
Yeah.
And if you feel that, no, I have some of the symptoms you mentioned, or I've been, a smoker for very long, and you want to seek help or attention or some form of screening, seek an appointment. But,
Right.
You may not be a candidate for a screening program, but you may still be a candidate for being assessed. There's
Right.
nothing wrong. Smoking doesn't only lead to cancers, and of course, it can lead to cancers in younger individuals too.
Right.
But it can lead to many other things like obstructive airway diseases or COPD.
Right.
And there's no harm in seeking help for any of these.
Right.
Okay? So
Right.
there's always scope for help. There's always scope for assistance with quitting. There's always a scope for early detection of any tumors or cancers, and regular follow-ups to make sure that you're not developing it down the line.
Right.
To your point, yes, aging does increase risk of developing cancers, but because the body's ability to heal and repair and to identify cancers, abnormal cancer cells, or check them, does slow down or
Right.
does become, a little more inefficient with
Right.
age. So
Right.
yes, you would have noticed that cancers are more common in an older age group than in a younger.
Yeah.
Not that it's not possible to have cancers in children. Children
Right.
can have cancers.
Right.
Adolescents can have cancers,
Right.
but the risk increases with age. Yeah.
Yeah. I remember when I was, 30, I'd be at the doctor all the time, just thinking, something's wrong, something's wrong. And they'd be like, nothing's wrong. Get out of here. There's nothing wrong with you.
Oh, well, don't overdo it.
I just remember, I'm a social worker, so it was like a very stressful time, the job and the home and
Mhm.
stuff. And the doctors were like, go home, nothing's wrong. And now I think back of that 30-year-old, like, nothing's wrong. But I know, that even at that age, you go and you talk to someone and you ask them, like you said, info at healthcity.ky.
Yeah, yes,
Yeah.
info at healthcity.ky.
Yeah.
Or if you're a telephone person and you generally like to hear somebody on the other end of the line, 640-4040.
Right. 4040, 640-4040 is all within your reach. So we're suggesting that anyone who is 50 and between the ages of 50 and 80 should definitely be in contact with Health City because you're having this targeted lung health check for $50.
That's correct. And this is for people with a history of smoking,
Right.
heavy smokers. If you're a current smoker, if you're a former smoker who's been smoking for a long time, you've quit within the past 15 years and you fit into those other boxes, you're the person we're looking for.
Right. And so in terms of your exclusion then, did we discuss a little bit who we're
Yes, so I
excluding?
said individuals who are already diagnosed with another type of cancer,
Okay.
particularly a non-melanoma skin cancer is fine.
Right.
Those are not the cancers which will affect your entire body.
Right.
If you've been diagnosed with any other form of cancer
Right.
besides benign skin cancer, you should first seek medical advice with your primary team,
Right.
saying if you're a candidate for individual lung cancer screening, because as part of your follow-ups, you would be having some screening CTs being done, and it would be an unnecessary test. If there are already symptoms of, with symptoms of lung cancer, sometimes that can also be an exclusion criteria for just a low-dose CT.
Right.
Although I wouldn't discourage you from having it, but you can discuss it with the physician with me, and then we can plan a proper scan or a different scan. But again, individuals who have who are unable to consent, right, or who have some other contraindication to undergo. Again, because of the age group we are screening, I'm not mentioning that by any chance there are any outliers and who may be pregnant. I'm not among women.
Okay.
I'm not a cancer for CT scans. So
Okay.
that, but because of the age group, I didn't really mention that earlier.
Right.
Of course, pregnancy is a contraindication to any scans, any radiation exposure.
Right.
Mhm.
So
So
that,
you thought the age range kind of covered that anyway.
yes, but you
Right.
can never be 100% certain. So I'm going to
Right.
still mention it.
Right.
So if you
Right.
suspect you may be, do not, walk
Right.
in for a screen. Make sure you're not pregnant before you do that.
They're doing all kinds of things these days.
Yes,
You
that's
never
right.
know.
So I have to mention it just for the safety of all individuals.
Right.
And again, if you have very typical symptoms of lung cancer, like a persistent cough, coughing up blood, significant weight loss, in the last few months, then again you may benefit from a more detailed scan.
Right.
So again, think about it, but a low dose CT scan may be a good beginning point. But these individuals would benefit from a contrast scan.
Scan earlier, breathe easier.
Mm-hmm.
Now, can I just quickly, as we close the show,
Mm-hmm.
if someone does the screening and what are some of the benefits to say that they might catch something earlier versus something else, like versus waiting, you know what I mean? Like I'd love to know that so that the
Yes, so
listeners
sometimes, with a sensitive test, a very sensitive test like CT scan, we may pick up many other things that can be seen on the lung.
Right.
Most times we can see benign nodules, which may again then cause some amount of anxiety, saying, is it, do we need to follow up?
Right.
But usually there are criteria, there are very specific radiological criteria to diagnose whether this nodule is of significance, does it warrant follow-ups, or does it warrant a biopsy. So those criteria, the internationally accepted criteria, are followed. There can be false alarms. There can be sometimes overdiagnosis, but I always believe, particularly in terms of cancer, maybe overdoing may be better than underdoing, right? So I'm not saying that there may not be false alarms or false pickups. Sometimes you may pick up a nodule and you may worry it's a cancer, whereas it may be a benign nodule.
Right.
But it's better addressed than left alone, particularly if it's size significant or it has features suspicious of a malignancy.
Right.
If it does not, it can be just watched. So there are criteria to advise at what range should we advise what.
Right.
So that is how we go about. Again, usually this is an annually recurring process of low-dose screening. Particularly, that's why this age group who are the most vulnerable and at the highest risk of developing it. So in case something is picked up and it's of uncertain, this thing, if they can wait for 3 months or 6 months or 1 month, 1 year will be decided. And on a subsequent screen, if the lesion remains stable, that's great, right? So these are ways of going about following up on these individuals.
But you'll just be on top of it, which is,
That's correct.
that's
That's
what's
correct.
important.
So picking up early is going to help. So if they're not size significant, there are tiny nodules, yes, we may pick them up, but nothing needs to be done about them.
Right. Right.
They're benign nodules, and anybody can have them, right?
Okay. Yeah.
But if they're size significant, they look irregular, you have a high risk, diagnosing it early, getting rid of it is a much better option, and reducing or minimizing your risk factors.
Right. So just reminding people who have a history of smoking,
Mm-hmm.
are 50 years and older, and are current smokers or have quit in the last 15 years to scan earlier and breathe easier.
Very true.
And this is to detect lung cancer at an early stage and allow them to get the treatment that they need and a better outcome.
That's true.
Yes.
Ultimately, we want to save lives.
Right. So, and the special promotion is $50 per patient this month for the month of November, which is Lung Cancer Awareness Month.
Very true.
And Health
Yes.
City.
Yes.
So again, to answer your previous question, a very quick one, there can be a relative risk reduction of 20% in lung cancer death by doing a low-dose screening program and detecting cancer. I think that's a large factor.
It is.
Yeah.
Yes.
I mean, we're talking about relative risk.
Right.
So in a high-risk population, if you do a screening, it can lead to a risk reduction from cancer death, which is great, right?
Right. And that
It's
is
worth it.
And that is Dr. Archita. She is the consultant in pulmonology, critical care, and sleep medicine over at Health City, as well as we're joined with Ben Mead, the marketing communications manager. This is your Health City Medical Monday. Talking about lung cancer awareness. One more time, remind them of where they can reach out to get this stuff set up.
640-4040. 640-4040. Or you can simply send us an email, info@healthcity.ky.
All right. So yeah, so get yourself set up if you fall within this category, and they can always go on to your website as well. Your website is very informative for sure.
That of course, if you're thinking, I thought I heard something, and you go to our website, it's right there on the home page.
Right.
You'll see the lungs, scan earlier, breathe easier. Click on that, and we have more information for you there.
Good stuff. Thank you all so much for joining me this afternoon. This has been your Medical Monday show brought to you by Health City, just talking about lung cancer awareness, which is the month of November. And to get yourself scanned early so you can breathe easier.
That's right.
There you go. Thank you all so much, Dr.
Yeah,
Archita,
yeah.
as well as Ben Mead. Thank you so much for joining me this afternoon as well. This has been your Straight Talk 5 5 show. I'm Catherine Tyson, your host. We'll talk again. Take care. Have a great evening.
You good?